Good morning, everyone. We were pleased to meet you and we very much appreciate your time. This lecture is presented by the Department of Nursing Education to explain the importance of providing health care to the category of geriatric patients because this care requires a lot of attention and very special care for those patients. So we're gonna start about what is the geriatric nursing. Geriatric nursing is a specialized field of nursing focused on providing health care to older adults. It addresses the complex and the varied health care needs of the elderly. As you know, even every patient has his or her own needs, considering both their physical and mental health. So you approach these patients holistically from the physical and mental approaches. Geriatric nurses are trained to manage chronic diseases, mobility issues, and cognitive decline, and to promote the healthy aging for those patients. What is the importance actually for specialized care for the elderly patients? Those older adults face unique health challenges, including multiple chronic conditions. You may gonna find that these patients suffers diabetes mellitus or hypertensive since long time, so they all the time suffers chronic diseases, increased frailty, and a higher risk of cognitive decline. So the geriatric nurses who provide the direct care to those patients have to provide the holistic care, as I said. So what are the factors influencing aging? Heredity, it may came from the hereditary, from the history or the family history, nutrition, health status, life experience with those patients, and environment gonna affect the patients directly and indirectly, and the activity they are going to do, the daily activities and stress produce unique factors influencing the aging of those patients. The normal age-related changes that those patients gonna face, the physiological, psychosocial, and cognitive changes. Let's jump to the physiological changes. They can have changes all over the systems they have in their body. So the cardiovascular system gonna affect these patients. For example, let us say the patients by aging or by age, the patients can suffer atherosclerosis, and the respiratory system, some patients, if they are, for example, on the smoking habits, they gonna suffer the COPD or the chronic obstructive pulmonary diseases, or also if they are not on a smoking regimen, these patients by aging have this respiratory system to be affected by the age itself and the aging process in the body. Integumentary system, there is big difference between the youth or the middle age and the elderly. They suffers a lot of signs that affect the integumentary system and the musculoskeletal system, stiffness, or other problems they have, genitourinary systems, and reproductive system, gastrointestinal system, and nervous system, and also the special senses. They have a problem in the vision, in the hearing, and all of the senses that all affected by the age. If we go to the psychosocial changes, the retirement, the time those patients go out of work and the routine of work, they go to the retirement. So the social isolations these patients gonna to face, and sexuality, elder neglect, elder abuse, and housing and environment. They are gonna to live alone without any caregiver, or you don't have the time to give to all those patients to sit with and listen. So those patients suffer from social isolation and live alone through the environment. Also, if they have death of one of the spouse, stress and coping in the older adults. About the cognitive changes, those patients suffers a lot of cognitive changes. One of them is delirium. So you all the time, if you communicate to those patients, you're gonna face that this patient suffers from delirium. So it is an acute confusional status and potentially reversible cognitive impairment that is often due to a physiological cause. There is changes in the dopamine, epinephrine, in norepinephrine in the brain cells. So this patient suffers delirium. Also the depression. All of these substances and the neurotransmitters in the brain cells gonna to be changed. So those patients with the social isolations and after retirement, they're gonna to face the depression. And also the dementia is the most sign of the cognitive changes is generalized impairment of intellect, age-related problems to those patients, osteoarthritis, osteoporosis, cardiovascular diseases, Alzheimer's, and many diseases and chronic diseases, diabetes and hypertensive. So what are actually the problem faced by those patients? Death of one of the spouse, retirement, physical decline, broken heart syndrome, financial burden. So you should make in your consideration that those patients should have special care regarding those problems. So the main focus of our nursing is the nursing care plan regarding those kind of population that we gonna to communicate. So the nursing care plan, the basic and the first step of the nursing care plan is the assessment. You should make systemic collection of the data to determine the patient's health status and identify any actual or potential that patients can face. And you gonna to set your goals, setting up specific, realistic and measurable, achievable or smart goals for long range of goals of geriatric patients by the healthcare team based on assessment and diagnosis. You should go to the diagnosis which is especially cared with identification of the actual or potential problem the patient face after you analyze your collected data. And the last step is the evaluation. So you're gonna in this step to determine of the patient's response to the care you give to the patients and your intervention, and to what extent the goals you have settled before achieved or has been achieved. So what are the roles and responsibilities of the primary nurse who provide the direct care to those patients? So all patients aged 60 years and older shall be prioritized for care and treatments. No waiting for the geriatric patients in the waiting area. So those patients in your prioritization of care assigned as priority regardless of the urgency of the condition or case. It is not a condition that patients suffers an urgent case. So from the beginning, if you're going to assess the patients, the age 60 and above the patients is prioritized in your care. Send all geriatric patients directly to the triage accompanied with one of the patient care technicians. No patient shall be triaged out, and the patient shall be seen by triage doctor and the nurse within 10 minutes. They shouldn't wait. And those patients requiring the blood extraction shall be sent directly to the blood extraction room without any waiting. All geriatric patients shall be prioritized in bed assignment and also shall be assigned as priority for a transfer by the emergency medical system team. Also, you perform and complete the initial assessment and nurse geriatric screening within 24 hours of admission of or earlier to those patients, and report the assessment finding to the main responsible physician for comprehensive assessment. You should develop an individualized nursing care based on your assessment to those patients and the unique needs of those patients. If we're gonna talk about the promoting the healthy aging, you should encourage independence and quality of life that is central to geriatric nursing, how to cope with the daily life, how to make the health promotion to those patients. Nurses educate patients and families on the lifestyle changes, exercise, nutrition, and preventive care strategies that promote the healthy aging. And also the patient's family education has a crucial role in educating patients and their families about care plans, treatment options, and disease management. This education helps family to be informed about the decisions and the patient care they need. This is one of the most important cards that the patients take before admission to your hospital. He or she can apply online, which we called it أولوية card or بطاقة الأولوية. Actually, this card the patients can request, as I said, by online, by entering his initial data, the age, and every single data for the patients, and he can take this card and come any other healthcare settings and provide this card to the healthcare providers, so those patients cannot go for the normal triage process. Those patients can prioritize the first, or these patients gonna to be on the first priority of all the healthcare givers to provide the special care. Again in Arabic, this card بطاقة أولوية دي بطاقة يقدر يطلبها الشخص من عمر 60 فيما أعلى عن طريق الأونلاين، بمجرد أن هو يدخل بياناته الشخصية والاجتماعية والديموغرافية فيبدأ يحصل على البطاقة دي، زي كبار السن اللي بتزيد أعمارهم عن 60، أو مرضى الرعاية المنزلية، أو الحالات اللي تمت الموافقة عليها من قبل أي لجنة طبية، ويبدأ أنه يجي بيها المنشأة الصحية. فيتوجب علينا احنا كهيلث كير جيفرز او اعضاء الفريق الصحي ان احنا مده الانتظار للبيشنتس داخل الامرجنسي روم اللي هي في الحالات في غرفه الطوارئ او في الاو بي دي او في الدي سي سي، البيشنتس المفروض ان هو نبدا نعجل بالتدخل الطبي لهذا البيشنتس، ويبدا تحويله دايركت على الرعايه تبعا لكل حاله من المرضى. وطبعا لازم نقلل عليهم فترة الانتظار، لان احنا حكينا كتير ان البيشنت ده عنده كتير ريسك فاكتورز تخلينا نقول ان البيشنت ده دايما يكون على اعلى اولويات الرعاية الصحية لكل الفريق الصحي. Again, those patients shouldn't be wait in the waiting area of the emergency room or DCC or OPD. Thank you for your cooperations. Listen carefully to this lecture and provide for your geriatric patients happy life and